Green button. Okay, thank you. That introduction was actually a nice setup for what I was going to talk about. I think, as we've seen in this meeting, a lot of research is increasingly suggesting that investments in the social determinants of health are not only not only improving health, but can actually be cost effective and cost saving. And as a result, I think there's a growing number of initiatives that we've heard about again in this meeting that are emerging to address the social determinants, both within the medical care delivery system, but also outside of that system in other sectors of the economy. But there are fairly significant economic impediments to investing in such initiatives. They include understanding what, in fact, the economic value is of a particular intervention, not only its overall value, but the timing of that value, because some interventions produce returns, economic returns on investment far into the future, and yet those can be significant. And the other is the wrong pockets problem that we've talked about in the previous session here. I think a better understanding of these issues might encourage cooperation among stakeholders in investing in social determinants increasingly. And so with funding from the Robert Wood Johnson Foundation, we developed an approach to think about how to invest in determinants of health and what the value of such investments might be, importantly, from the perspective of different stakeholders. And we use that approach to synthesize existing data. We're not creating new evidence, but to synthesize existing data about the impacts over time on health outcomes and the costs of investments designed to modify the determinants of health. So we're looking at these costs and outcomes characterized in ways that are important to different stakeholders in the public and private sector. In order to think about how to do that, we've developed this high-level framework for describing the impact of the social determinants of health. In the big box, I don't have time to go through this in great detail, but in the big box in the lower left, you see a list of determinants of health, some of them upstream, some of them more directly impacting health. Above that is a box that says if you put, by the way, those determinants interact in very complex ways, so it's not totally clear what an investment in one will do. But if you, in the box above that, we're looking at an investment in such determinants, and the impact of that investment as those determinants interact over on the right-hand side has an effect on healthcare costs, it has an effect on health, it has some non-health impacts, and in fact, many of the investments that are in the determinants of health might not even have as their principal purpose improving health. And of course, up at the top of the four boxes in the center there, the intervention frequently has a cost. What we would like to do is understand what those impacts are from the perspective of different stakeholders. And the shaded in boxes there represent a tool that we have built to help us understand those investments. The tool, which we call the Value of Health tool, takes as input some very specific, intervention-specific impacts as a function of age on things like morbidity, mortality, healthcare costs and earnings, as well as some generic economic inputs, and produces as output an overall value to different stakeholders. Right now we have built into the tool society as a whole, the federal government and state and local governments, as well as the healthcare spending impact part of that, and some other measures that attempt to capture cost effectiveness or return on investment. We have applied this tool in a variety of applications, and you see that there is quite a variety here. Much of the work that's involved in using the tool is upfront work to generate the impact of a particular intervention on things like morbidity, mortality, earnings downstream, and so forth. And so because the tool itself is generic, if you do that work, you can apply it in a whole variety of contexts. Let me just briefly mention one of those contexts in which we have been applying it. With regard to lead remediation, We have looked at the impact of reducing the exposure of lead of children to lead poisoning in three particular interventions, looking at lead water service line replacements, lead paint hazard control, that is lead paint and controlling the exposure to lead paint in older houses, and lead-safe renovation and repair standards, that is using lead-safe standards when an older house is being repaired that may have lead in it. In each of these cases, you see a fairly significant improvement in blood lead levels and resulting health. You also see that in each case you get a positive return on investment for the investments in those interventions. What I don't show here, though, is the fact that these returns accrue to different stakeholders. We computed that, but I'm not showing it here, and also accrue over time. And in fact, the largest part of these returns have to do with improved downstream income, which are very long-term returns. So understanding the extent to which there are timing impacts here and there are different stakeholder impacts, I think can help us to better understand when we ought to be investing in these kinds of interventions. Happy to discuss these things further during the discussion period.